Good evening, everyone. Thank you for joining us. My name is Jan Lazarus. I'm the owner of the JP Institute, and I'm here tonight with Dr. Jackie Russo, the president of the American Academy for Oral Systemic Health, who's also a nurse and a dentist from Delray Beach, Florida. We're really excited to share with you some of the details about the PharmaNex Wellness Program and its technology that was shared at the recent AASH conference. So we will demonstrate how it can benefit your patients, not only for their oral health, but for their longevity and quality of life.
Well, thank you, Jan. I am really excited to be sharing this information as it was truly a life-changing event for me, as many people that I spoke with at AASH already know. So in honoring everyone's time, let's just jump right in. Like Jan said, we're going to be discussing the value of adding an evidence-based nutritional program into our practices. Now, you might ask why? Well, as you can see from this slide and the next few, there's a huge need in our country. We are the most overfed and undernourished country on the planet, and the main reason is what we're eating or not eating, and that is real food. What we're eating is full of sugar, chemicals, pesticides. It's probably been irradiated and probably definitely genetically modified. And even the fruits and vegetables we do eat have been picked unripened, and because of the way we farm today, much of our food is basically devoid of any nutrition, and for sure it's drenched in poisonous chemicals. In a recent study, I think this is so cool, that was put on by the World Health Organization, families that were represented from over 10 countries were interviewed about their diet. They were asked to take a picture of their weekly food supplies in a typical week. Now, this is Ecuador, a pretty poor country. To take a look at their diet, there's no crap food here. This is just a healthy plant-based diet. Next up, we've got Egypt. And again, you see right up front, lots of colorful fruits and vegetables. The next country is Bhutan, the same thing. I mean, just simple, real food. Now, let's take a look at Mexico. Close enough to the United States to easily get exports like Coke and our favorite breakfast cereals, right? But you still do see some fruits and vegetables, so, all's not lost. Next is Italy, and as you would expect, lots of foods from the Mediterranean diet, also a lot of grains. And guess what? You still see sneaking in the back the Pepsi and the breakfast cereal. Now we come to Germany, a wealthy country. They certainly spend a lot of money on their food, and beer too, right? But they sure don't have as many fruits and vegetables we've seen in the other countries, and they sure don't look very happy either, do they? As we get more industrialized, it seems we get crappier diet. And now, and I think this slide is pretty instructive, meet the Rivas family from North Carolina and look what they're eating. It's a colorful diet, I grant you, but sorely missing in the fruit and vegetable department. In fact, trying to find one is like finding Waldo. How healthy can this family be? Well, newsflash, this is exactly what most of your patients are eating. And the results to our society's well-being are dire. We are a sick society. We're obese, diabetic, arthritic. We're suffering from autoimmune diseases, leaky gut, Alzheimer's, heart disease, cancer, you name the disease, and it's on the rise. And for the first time in our nation's history, our children are having shorter lifespans than their parents. So it's no surprise that we see metabolic syndrome as one of the fastest growing conditions in our country. And it's a problem that's completely by choice. But the good news is it's also reversible if we can get our patients to change their diets, their lifestyle, and their mindset around wellness. Listed on this list are just some of the conditions that are a direct result of the standard American diet. And as you can see, periodontal disease is right in the middle of the pack. So based on this information that we're going to be providing you is all about a turnkey program to bring nutritional assessment and counseling into your practice using objective metrics, pharmaceutical-grade solutions in a way that can be profitable to your practice. Now, David Mines is a well-known dietitian and speaker in the dental circles, and he has the most incredible vitamin R collection. In fact, it's over 100 years of vitamin history. When I visited him recently, this poster just caught my attention. It's from the 1950s, but even 70 years ago, we knew that nutrition was the key to oral health, the key to the prevention of tissue starvation. Yet, where is this coming up in our conversations with our patients today? At the most fundamental level, nutritional health is one of the most influential factors we can use to help affect our treatment outcomes by modulating the host response. The underlying cause of metabolic syndrome in most all chronic diseases are free radicals or reactive oxygen species. These free radicals are produced in the body when we're exposed to toxins, when we go out in the sun, when we're under stress, when we fly and are exposed to increased radiation. But they're also produced when we exercise, so they cannot be avoided. But if they're not neutralized, they will make us sick and cause disease. In fact, the amount of antioxidants in our bodies determine how long and how well we will live. So a simple analogy is if you cut an apple and expose it to air, it ages and turns brown, right, pretty quickly. But if we put lemon juice on the apple, the vitamin C, which is a strong antioxidant, neutralizes the oxidative process and it stops the aging. And that's exactly how it happens in the body. In the interstitial space, antioxidants act like a force field. They surround the cells and they protect the DNA from the free radical assault. The cell takes over 70,000 of these free radical hits daily, so the stronger the antioxidant network, the higher your antioxidant score, the better. This neutralization of the free radicals lowers the risk of DNA damage and ultimately getting, sick or at least accelerating the aging process. So since antioxidants, with the exception of glutathione, are not produced at all in the body, we have to be sure to eat a lot of fruits and vegetables and take high-quality supplements to keep this antioxidant network robust. To further the validity of addressing nutritional health on all of our patients, just as a routine vital sign, I'm going to quickly share some research that I think is compelling. Now, we have a whole compendium of research available if you are interested in reading more, and we'll be happy to send those to you. But this article from the Journal of Nutrition describes the relationship between serum antioxidant levels and the incidence of severe periodontal disease. The researcher, Ian Chappell, is a well-known British researcher who studied the supportive role of nutrition in dentistry for over 20 years, and he's published numerous articles on this topic. And basically, it just says the higher the antioxidant levels in the body, the lower the risk for severe periodontal disease. Now, this next article is found in the Journal of Food and Drug Analysis, states clearly that there is an indispensable role of dietary antioxidants in periodontal health. This next study is from the Journal of Clinical Periodontology, and I love the concise message. Basically, it just puts it right out there for us. For prevention and treatment of periodontitis, daily nutrition should include sufficient antioxidants, vitamin D, and calcium. Inadequate antioxidant levels may be managed by higher intake of vegetable, berries, and fruit, or by phytonutrient supplementation. But you have to have a way to measure, right? This next study is out of oral microbiology and immunology, and it looked at supplementing the diet with omega-3 fatty acids or fish oils and how that would exert anti-inflammatory effects in the gingival tissues and be protective of alveolar bone by what? Modulating inflammatory cytokines. Next, we have a study discussing the important role of vitamin D in periodontal maintenance. Now, we already know how important the role of vitamin D is systemically, So it's no surprise that vitamin D is really important in periodontal health. Now, this next study I had to include, it's kind of like the duh story. I mean, we really had to do a study to understand that a poor diet was significantly associated with increased odds of oral disease. Could we just substitute any disease? But the next statement, dietary advice for the prevention of oral diseases has to be part of routine patient education practices, and that speaks volumes. So for those of you who attended the recent AOSH conference, you heard about all the stressors and potential toxins that we're exposed to in the dental field, right? Like nitrates and mercury, and not to mention just the physical and mental stress of being a dentist. But when you couple that with high oxidative burden and exposure to multiple toxins, you have an even greater need to protect your DNA from free radical oxidation. So as healthcare providers, it really is our key takeaway. Doctors and hygienists, we have to heal ourselves so that we can help our patients. Okay, so now that we understand how antioxidants quench inflammation and free radical damage, we understand how important this biomarker is to address with our patients to improve our treatment outcomes. But it's just as important to note that many of our clients will tell you that this technology is the single most important piece of equipment in their practice because it's a tremendous behavior modification tool. Kind of like a scale, you got to get on it every time you go to the doctor. You try to get really skinny before you go. But, your patients, because they're going to be seeing you very regularly, are going to continue to get rescreened, and they're going to want to see their scores go up. So what's going to happen? They're going to maybe have, they may want to just, change some of the other bad habits, especially when we tell a compelling story, like how important antioxidant status is and that it can be modified to prevent all the diseases of aging, including even metabolic syndrome. So we talked about the Great American Diet, or I should say the Standard American Diet, the SAD diet earlier, and I wanted to share with you the National Institutes of Health recommendation for optimal health and prevention of disease. The recommendation is 9 to 13 servings of fruits and vegetables a day. That's a lot, right? And in their study, only a very small percentage of adults met these guidelines, less than 1% of adolescents, and only 3.5% of adult women were even close to getting what they needed. So I hope you're starting to see this overwhelming problem that we have in our country. And more importantly, I hope you are starting to envision how you can become part of the solution. Now, this next Harvard medical study, Harvard did a study partnering with the USDA that involved 25,000 Americans. They followed them over a 6-month time period to see how many of these 25,000 met the RDA, the recommended daily allowance. Now, that's different from the amount for optimal health. That's only the amount to prevent scurvy or beriberi. They wanted to see how many people over 6 months would meet those 10 essential nutrient RDAs. You're not going to believe how many. Not one American out of 25,000 reached that benchmark. So when that study came out, the AMA decided that they better make a recommendation that all adults take a multiple vitamin daily. So at least the medical community is admitting that we have a problem, but who is doing anything about it? You're certainly not getting any nutritional advice from your doctor. So we are saying to you, it is time for the dentist to step up and play this important role because we are literally digging our graves with our forks in this country. Let's talk a little bit about the biophotonic scanner. I want to just make this clear. It was not developed by Pharmanex to promote its products, but it was invented at the University of Utah with a grant from the National Institutes of Health in partnership with the Moran Eye Institute. They were studying antioxidant status and the incidence of age-related macular degeneration. there is a causal relationship for this disease. Now, this scanner is the only technology that non-invasively and more accurately than blood testing measures antioxidant status in the body. And it's being used in research in universities all over the world to study nutrition, aging, and prevention and incidence of disease. Pharmanex acquired the patent rights to this technology and spent about $100 million to bring this technology to the medical community. Now, what it's actually measuring is over 16 different antioxidants, a classification called the carotenoid or the lipid-soluble antioxidants that are found in our food, and it's measuring it in the stratum corneum of the skin because that's an easy place to access on anybody, right? Now, they measure these particular antioxidants because they're the crash helmets of the antioxidant family and can neutralize up to 20 free radicals before they become inactive themselves. And again, since we don't manufacture these nutrients, we have to put them in our body on a daily basis to keep that network robust. Now, some of you may be wondering, how in the world does this technology really work? Well, the scanner is based on a phenomenon called the Raman effect, which is a Nobel Prize-winning technology that describes the optical scattering of light waves. It's very similar to the technology of a radar gun that a policeman used to see how fast you're going, right? So when the light wave emitted from the scanner is reflected off the carotenoid molecule, it scatters the optical signals in such a way that they are detected in the scanner. And the amount of Raman scattering is used to quantify the carotenoid concentration in the skin, giving us our skin carotenoid score. I hope that is simple enough. So these scan scores have been clinically correlated in the scientific literature. This study that you're seeing on the screen right now was done with over 400 Pharmanex employees. And this graph shows that as urinary isoprostanes, which are the gold standard measurement for oxidative stress in urine, these urinary isoprostanes have an inverse relationship. So as your oxidative stress goes up, your scan scores go down. Now, most physicians would have you do a 24-hour urine to obtain this information, but I'm telling you that you can find out this exact same information by doing a 30-second scan in your practice. You can understand what your patient's oxidative burden is coming in for the first time when you see them as a new patient, and it will have an impact on their treatment outcomes, and I'm going to show you that in a minute. So the scanner carotenoid scores have also been clinically correlated to plasma carotenoid levels in a study published in the Journal of American College of Nutrition. And in this study, 372 subjects that confirmed that there's a significant correlation between serum carotenoid levels and skin carotenoid levels as measured by the biophotonic scanner. Not only that, but they also demonstrated that the biophotonic scanner measurement had less variability than blood levels using high-performance liquid chromatography. And let's talk about that for a second, because the scanner looks at the past 90 days average scan scores, kind of like an A1C does for blood sugars. But if you're just doing, a blood glucose, you're getting a snippet in time, and that's the same thing that's happening with serum carotenoids. If you just drank, a big green juice full of carotenoids, your blood levels are going to be elevated at that moment. But that doesn't mean for the past 90 days you've been protected. So it's kind of like that, which I think is really cool. It just shows that this technology is a viable, reliable, and cost-effective risk assessment tool to measure antioxidant status, and it's perfectly suitable for use in a dental or medical practice. Now, for those of you who were scanned, let's just take a quick look at the results. This scoring is set up like a report card. The scale goes from 0 to 200,000. The lower the number is the worst, high oxidative stress. So the red zone's red for a reason. It's an F. These patients who score here typically have a chronic disease. They smoke. They take a lot of medication. And they will usually present with symptoms of fatigue, inflammation, and maybe even chronic pain. Orange is a D, and so on. In our practices, we want our patients to score in the blue zone with a minimal score of 50,000 and optimally even higher, right? Because the score goes all the way to 200,000. That's a long way from, perfect at 50. So it's kind of like your bank account. The higher, the better. Now, most patients who eat the standard American diet are going to score in the 20,000 range. And at this level, as we already know, they're aging more rapidly than they should, and they're very susceptible to degenerative and chronic disease. And your treatment outcomes will be reflective of this, as I'm going to show you in a minute. Okay, so once we identify deficiencies, we've got to be able to provide some viable solution to our patients, right? And we always start with food, plant-based diet, and we give them, collaterals, educational information with things like this, the top 20 foods that give you the most bang for your buck. And we remind them that they need to be eating 9 servings of these organically every single day. But the sad thing is most people aren't going to be able to eat that way every day of their life, and it's why the AMA recommends we all need to supplement, right? But how do you know what products to take or to even recommend? Well, I'm not going to go into a whole product review tonight, but the reason we recommend the PharmaNex product is after a thorough vetting of the company, their science, the 22 peer-reviewed clinical studies on the products, and all of that's available if you're interested. But understand that PharmaNex products are pharmaceutical grade. They're all listed in the physician's desk reference. They're independently tested and certified by the Consumer Lab, the Banned Substance Control Group, and the National Safety Foundation. And they also submit to random testing to maintain their good manufacturing practice qualification. And the best thing of all is that they're performance guaranteed. So anybody who takes these products for 60 days as directed, if their antioxidant status does not increase, the company refunds your investment 100%. And that's unheard of in the industry. Now, PharmaNex takes their science seriously. You're not going to find another nutraceutical company with 75 in-house PhD level scientists. Every product is clinically tested for safety and efficacy before they're brought to market. So you can rest assured that these products are quality and safe. They're manufactured in a $10 million research campus that uses rigorous testing and their own quality control. Jan and I have both visited this lab many times, and we would invite you all, if you choose to partner with us, to do the same. Now, before we wrap up, I want to share a couple of things with you. Next is a case study that was conducted in a dental office in Austin, Texas. It was a 120-day study. There were 40 patients selected based on having mild to moderate periodontal disease. Could you go back one, Jan, please? Mm-hmm. Go back. They were placed on our flagship product, LifePak Nano, for 120 days. No prophy, no periodontal therapy was performed. They were told not to change their oral hygiene habits, not to change their diet, not to do anything different for those 120 days, and they were brought in and monitored monthly. So here is how they started out. There were these 40 patients. Their average scan score was 27,000, the standard American diet, right, in the 20s. We measured 168 periodontal sites, so there were no missing teeth. There was an average of 50 sites bleeding and inflamed initially, meaning 30% of the mouth was diseased. After 120 days, the average scan score was 51,000. Now, we expected that because they were taking a quality nutritional product that was intended to increase antioxidant protection. We still measured the same amount of sites, but there were only 10 sites bleeding and inflamed, only 6% of the mouth disease, which means we had an 80% improvement in disease sites using nutritional support alone. That blew our minds. We did not expect that kind of a response. So based on that, what we can say is that nutritional support alone has a significant impact on the body's response to oxidative stress, as demonstrated by the improvement of the scan scores, right? Objective, valid measurement. The next thing that we can say is lowering the oxidative burden somehow reduced inflammation and bleeding on probing by 80% without any therapeutic intervention. So can you imagine if we eradicated the pathogens, got rid of the biofilm, continued to provide nutritional support and increased home care? What might happen to periodontal disease in our country? Maybe it's gone. Maybe it's a thing of the past. So we were pretty excited about that, and we encourage all of our partners to run a similar test in their own office so that they can build the validity in their minds and in their team's minds, because this has been reproduced. So let's just summarize the benefits of bringing a wellness program into your practice. Number one, it's going to improve your personal health, and that's a big deal. Next, it's going to improve your patient's health, and it's going to improve their treatment outcomes. It's going to be an incredible employee wellness program. Your employees aren't going to get sick anymore because their immune function's working. They're going to be so grateful to you for caring about them that they're going to be very loyal employees, which decreases turnover. It's a great marketing strategy because it's going to allow you to differentiate you from every other dentist on the block, right? And it's going to provide a profit center without additional overhead. And what I want to do now is talk about just that, the ways that you can generate income using this program. So there are two ways to generate income. One is strictly straight cash off of the screening fees. Now, we recommend $20 as a fee for the screening, but we've got practices in Manhattan that charge $100 because they believe that this is that valuable of a vital sign. So, 20 to 100, whatever you think. Now, the second source of income is on product sales. The percentage is 5 to 44%, depending on the sales volume, and we can show you a spreadsheet that will help you predict, where you would fall in that. You do not have to keep inventory. That's what I love about this program. Everything is directly shipped fresh from the lab to your patient's doorstep. They have their own online portal where they purchase their products at wholesale pricing. That's right, wholesale, the same price that you pay for your products. And that feels good because, people are skeptical when you're selling products out of your office. They know you've had to mark them up in order to be able to offer them. And maybe you're just trying to sell them to them because you're going to make money on them. But if you tell them that you're paying the same price that they are and you take them every day, well, that's a little bit different relationship. Now, they can also do an auto refill every month or every other month for an even lower cost. And the products are shipped for free if they're over $49. So it's really a great business model. And just to show you a business case study, let's say you're a solo practitioner, you screen 10 patients a day, because we're going to recommend you screen every new patient, and once a year you're going to screen every hygiene patient. You're charging $20 per scan. Only 10% of the patients that you screen are going to order a product. Let's just use that 10% number. So that's one a day. And 50% of those people are going to quit taking them after 1 year. I can't do it, whatever. You're still going to have an annualized income of $100,000 in the first year, and that's only going to go up, each year from there. So I'll show you what the investment is now. In order to partner with us, you would purchase a $3,395 package that would allow you to qualify to bring the scanner into your practice. Now, remember, you don't own the scanner. You're not buying the scanner because it's the intellectual property of the University of Utah and the National Institutes of Health. But Pharmanex has the patent rights on the technology, so you can lease it. It's not really a lease, but for $125 a month, you're going to get 50 scan cards per month, a loss and damage waiver, unlimited technical support, software upgrades and repairs or replacement, let's say it's stolen. So that's the $125 a month. In this $33.95 package is a product sampling, different products for you to try, your team to try, just to get an idea of how these, what these products look like, how they taste, et cetera. You're going to get an invitation to join us at the National Symposium for Healthcare Providers at the corporate headquarters that I was telling you about. You're also going to get 300 scan credits on top of the 50 per month. You'll start out with 300 so you can screen your patients. You're going to get $300 of product credit, and we can help you figure out, what products you might want to buy. You're going to have your own online store. Now, one of the most important things you're going to get is training, and you're going to get training from some of the best, like JP Institute, like Jan Lazarus, like Liz Lundry, and some of our other partners across the country. So you're not going to just get a scanner dropped in your lap and say good luck. We're going to make sure that you're successful, and we're going to teach you how. So we hope you will join us. Now, it's about time to wrap up, but we hope that in some way we've opened your eyes to the possibility of bringing wellness into your practice. Whether it's a PharmaNex program or another evidence-based program, it is now time to start talking about nutrition in the practice. And you owe it to yourself, you owe it to your patients to empower them with knowledge about nutrition and how it can dictate the quality of our lives. Ignorance is no longer an excuse because you now know. So we hope you'll join us in this wellness revolution and be part of the solution to wellness in our country. And if you'd like more detailed information about implementing this program before you make a commitment, please reach out to either me, my partner Jan, or Liz. And please remember this. This is something Helen Keller said. The only thing worse than being blind is having sight with no vision. Please do not turn a blind eye to wellness. Your patients are counting on you. So go out there and be well and help others be well also. Thank you for tuning in, and good night.